Hello and welcome to another episode of Health Matters. I am your coach today, Dr. Michael Chillemi. And on this episode, we are going to talk about something that affects millions and millions of men on a daily basis. So we're going to call this Beyond the Stigma, a comprehensive guide to the prostate gland and prostate cancer. So we're going to embark on an essential, often under-discussed journey into the world of prostate health. The prostate gland plays a pivotal role in men's well-being, yet it is shrouded in a cloud of stigma and misconceptions that can prevent many from seeking information that they crucially need. Whether you're here out of curiosity, supporting a loved one, or taking on a proactive step for your own health, this episode will serve as your go-to resource for understanding the anatomy, the function, and the potential health changes connected to the prostate. Together, we will unravel facts about the prostate cancer, causes, treatment options, and associated conditions, arming you with knowledge that empowers better health decisions. So let's get into it and understand it. So in understanding it, you have to know, what is the prostate gland? So the anatomy of the prostate gland, the prostate itself is a small walnut-shaped gland located below the bladder and in front of the rectum in men. It wraps around the urethra, which is the tube that carries urine and semen out of the body. The primary function of the prostate is related to reproduction. So the prostate produces seminal fluid, which transport semen during ejaculation. So let's get into the anatomy breakdown. So the zones of the prostate. So the first zone we're going to say is the peripheral zone, contains the most glandular tissue and is a common site for prostate cancer. Central zone surrounds the ejaculatory ducts, and the transition zone surrounds the urethra and is often affected by benign prostate hypertrophy, BPH. Okay, in talking about the anatomy, let's talk about the size and growth. So at birth, the prostate is about the size of a pea. During puberty, testosterone stimulates growth, and the prostate becomes the size of a walnut as you grow up and become a man. As men age, it can enlarge further, potentially leading to health issues. So let's get into prostate cancer itself. I'm going to talk about a lot of different topics, and we're going to go back and forth a little bit between a few of them, but I wanted to jump right into the cancer part because that's, a big problem that most men want to understand a little bit better. So I'm going to do that now. So prostate cancer, what is it? Prostate cancer occurs when malignant or cancerous cells develop and multiply uncontrollably within the prostate gland. Again, the prostate is walnut-shaped and right below the bladder and in front of the rectum. So when we have this abnormal growth in the gland, it can form tumors, which are often characterized as either benign, which are non-cancerous, or malignant, which are cancerous. In cases of prostate cancer, the cells within the prostate mutate, bypass normal cellular regulation, and spread beyond the healthy tissue boundaries. Let's give you some stats about the prostate. Prostate cancer is one of the most prevalent cancers among men worldwide, making it a significant health concern. Here is a closer look at some of the statistics. Prevalence in men and I say prevalence in men because it's only in the men, right? So women don't have it. It's only in men. Around 1 in 8 men will be diagnosed with prostate cancer in their lifetime in the United States. This statistic highlights its frequency and underscores the importance of regular screening, especially in men in higher risk groups. Age factor. Prostate cancer develops more commonly in older men, particularly those over 65. This is attributed to accumulation of exposures to risk factors over time, hormonal changes, and age-related cellular mutations of the prostate. Types of prostate cancer. You could have slow growing or aggressive prostate. And the behavior of the prostate cancer can vary significantly. So let's go into slow growing prostate cancer. In many cases, prostate cancer does grow slowly and possesses no immediate threat to life. These cases might not require aggressive treatment and may instead be monitored through active surveillance, periodic checkups, tests, and biopsies to ensure it remains inactive without spreading or worsening. On the other hand, if you have aggressive, potentially deadly prostate cancer, these are considered fast-growing and invasive, with the potential spread to nearby organs or distant body parts, such as bones or lymph nodes. If that happens, that's called metastasis. This form of prostate cancer can become life-threatening if not detected early and treated early. Aggressive cancers are more likely to require a combination of treatments, whether it's surgery, radiation, or hormone therapy. And I'm going to say this a few different times during this podcast. Why screening matters. Given the widespread spectrum of prostate cancer from harmless to fatal, early detection is key. Routine screenings through methods such as prostate-specific antigens, your PSA on blood tests, or digital rectal exams by your primary physicians allow doctors to catch potential signs of prostate cancer before symptoms arise or before progression advances to the next stages. Listen, no one likes getting a blood test or digital exam, but guess what? It might just save your life. Okay, section 3. Let's get into associated conditions with the prostate gland relating to both benign and cancerous conditions. So the first one, I'm gonna list 3 of them and then I'll break them down into detail. So the first condition that we're going to go into is benign prostatic hyperplasia, BPH. Second condition we'll talk about is prostatitis. Both of those are considered benign. And then we'll talk about prostate cancer, which is cancer. Okay, so the first one we're going to talk about is benign prostatic hyperplasia, BPH. What is it? BPH is a non-cancerous enlargement of the prostate gland. It is very common in older men and caused by gradual growth of the prostate as men age. How does it happen? The prostate surrounds the urethra. Again, that's the tube that carries the urine and semen out of the bladder. As the prostate enlarges, it can press on the urethra and partially block the flow of urine. Some of the symptoms that you're going to have with this are difficulty starting urination, weak urinary streams, frequent urinations, especially at night, feeling that the bladder isn't fully emptied. Treatments. Mild cases may be monitored, watchful waiting. Medications like alpha blockers or other medications to reduce or relax the prostate. In severe cases, there is something called TURP, transurethral resection of the prostate may be performed to remove a part of the prostate. Second condition we'll talk about is prostatitis. What is it? Prostatitis refers to inflammation, sometimes by infection, of the prostate gland. It can affect men of any age, but is more common in younger and middle-aged men. It can present suddenly, acute, or develop slowly over time. How does it happen? Prostatitis may be caused by a bacteria infection, pelvic floor muscle disorder, or non-infectious inflammatory due to other factors. Symptoms: pain in the pelvis, lower back, or genitals, pain during urination or ejaculation, urinary urgency or frequency. You could have the fever or chills, especially in bacteria type infections. So there are a few different types of prostatitis. Let's get into it. Acute bacterial prostatitis, a sudden bacterial infection, often severe and requires antibiotics. Chronic bacterial prostatitis, a long-term bacterial infection with recurrent symptoms. Chronic prostatitis or chronic pelvic pain syndrome, the most common type, often with no clear bacteria causes leading to persistent pelvic pain. Asymptomatic inflammatory prostatitis, where there are no noticeable symptoms, but inflammation is detected during other medical examinations. Treatments for these conditions are typically antibiotics for the bacteria infections, pain relievers, or muscle relaxers for symptom relief, and lifestyle modifications, including dietary changes. Okay, let's get into the big C, prostate cancer. Prostate cancer occurs when cells in the prostate grow in an uncontrolled, abnormal way, forming a tumor. It is one of the most common cancers in men. How does it happen? The exact cause is unknown, but risk factors include age, the most common occurrence in men over 50, family history, ethnic. It typically happens more common in African American men, and certain genetic mutations. Those are the causes of it. In the early stages, prostate cancer may grow very slow and cause few or no symptoms. In some cases, it may grow aggressively and spread to other body parts. We talked about that, right? Slow growing and fast growing. Where it spreads. So if you have cancer and it metastasizes, so metastasize means it spreads. The two most common areas are bone, which is a common area to spread, especially leading to pain and fractures, or your lymph nodes. It can spread through the lymphatic system. Symptoms, if present, trouble during urinations or blood in the urine, pain or stiffening in the lower back, hips, or pelvis, weakness or numbness in legs when cancer presses on spinal nerves. How do we detect it? Again, PSA, blood test, or digital rectal exam. Also, you will have a biopsy to confirm if it's cancerous or not. Treatment for cancer. Active surveillance for slow-growing cancers, monitoring without immediate treatment, surgery, radical prostatectomy to remove the prostate gland, radiation therapy to kill cancer cells in the prostate, hormone therapy, reduce the level of male hormones like testosterone, which may fuel future cancer growth, chemotherapy used for advanced cases, and targeted therapy focuses on genetic mutations or signaling pathways. The prostate gland, while small, is prone to various conditions. The ones we just spoke about, the BPH, prostatitis, and prostate cancer. They are really affected, and it's really important to have early detection, and appropriate management plays a key role for outcomes of these conditions. Okay. Next is going to be section 4, which we're going to talk about is symptoms, how prostate conditions can affect your life. Prostate-related conditions can profoundly affect the quality of life. Common symptoms include BPH, prostatitis, or prostate cancer, which can lead to a ranging of a whole variety of symptoms that can affect not only your physical, but can affect your emotional, social, and overall quality of life. Let's break down the individual symptoms of this condition and the broad impact. So the first, let's talk about the biggest one that a lot of patients talk about is difficulty starting or stopping urinations. So this symptom is often caused by an enlargement of the prostate, which can obstruct the urethra. Patients may experience hesitancy when attempting to go to the bathroom, or a sensation of an incomplete emptying, meaning you feel like you have to go, but there's nothing there. It can lead to frustrations and significant interruption into daily activities, as individuals may spend longer than usual trying to empty their bladder. Weak or interrupted urinary stream. So a weak flow or interruptions while urinating occur due to the presence of obstruction caused by prostate enlargement or abnormalities. The symptoms can lead to anxiety or embarrassment, particularly in public settings like workplace or bathrooms, and may also prompt concerns about underlying health issues. Number three, we're going to talk about is increased frequency of urination at night. So this is called nocturia, which means frequent urinations during the night. It is a very common symptom of the prostate condition. It is often the inability to fully empty the bladder during the day and late at night. Typically, it interrupts your sleep pattern and can make you fatigued, tired, irritable, reduce your concentration, and affect the quality of your life. The persistent need for bathroom visits during the night can strain relationships or impact one's ability to travel or engage in social activities. It's very frustrating. I talk to a lot of my patients, and they say they wake up 2, 3, 4 times a night. And I encourage them, if that's happening, please go see your primary, get your prostate checked, because that is not something that should happen. I think people expect that as they get older, that is, oh, they've heard their father, grandfather, or uncles talk about, yeah, I get up during the night and it does this. It doesn't have to. It's not supposed to, right? So if it is, then let's make sure that it's not prostate cancer. And if it is another condition, let's make sure you get the help you need. Okay, number 4, sorry. Pain or discomfort during urination or ejaculation. So pain may occur due to inflammation, prostatitis, infection, or pressure from an enlarged prostate. During ejaculation, it may also result in discomfort or reduced sexual satisfaction. Such symptoms can contribute to emotional distress, reduced self-esteem, and avoidance of sexual activities, potentially straining intimate relationships. Okay, number 5, blood in your urine or semen. This is alarming. It is known as hematuria or hematospermia, can be indicative of a more serious condition such as prostate cancer or infection. The sight of blood often produces anxiety and prompts individuals to seek medical advice, as it is a clear indication of a problem requiring intervention. Number 6, sexual dysfunction, including erectile issues. Prostate conditions typically can affect sexual health, including erectile dysfunctions, basically difficulty achieving, maintaining an erection, or reduced libido. For many individuals, sexual health is closely tied to emotional well-being and relationship dynamics. Sexual dysfunction can lead to feelings of inadequacies, depression, or strain between partners. Impact on daily life. So these symptoms collectively contribute to disruptions in physical and emotional well-being. The daily activities of urinary urgency or difficulty disrupt work schedules, exercise routines, or leisure activities. It affects your sleep patterns. Frequent night urinations leading to poor sleep may affect your energy level throughout the whole day. Mental health, persistent discomfort, anxiety about symptoms, and worrying over underlying conditions such as prostate cancer can result in stress, depression, or even fear. Relationships, strained intimacy coupled with emotional ups and downs may affect communications and connections with partners, family, and friends. This is why, again, early detection matters. Understanding these symptoms and their impacts are crucial to ensuring detection and treatment. Some prostate conditions, like prostate cancer, can have subtle or absent symptoms in their early stages, making routine checkups essential. Early management can prevent progression, improve diagnosis, and maintain your quality of life. Okay, section 5, causes. How do you get prostate cancer? To provide a more detailed understanding of the factors contributing to the development of prostate cancer, while the exact cause of prostate cancer remains unclear, several risk factors have been identified. These can increase the likelihood of developing the disease. The risk factors include, I'm going to go over them and then I will explain them a little bit more in detail. Number 1 is age. Number 2 is family history. Number 3 is race or ethnic. Number 4 is diet and lifestyle. Number 5 is hormone levels. So number 1, risk factors of age. Age is one of the strongest risk factors for prostate cancer. The likelihood of developing prostate cancer rises significantly after the age of 50. Why? As men age, changes in their hormone balance, genetic stability, and immune function can make cells in the prostate more susceptible to mutation, which may lead to cancer. Statistics, more than 2/3 of prostate cancer cases are diagnosed in men over 65. Implications, regular screenings, PSAs are essential. PSAs and digital exams over 50 are essential. Okay, family history, genetics and hereditary risk. Key factors. Having a first-degree male relative, father, brother, or son with prostate cancer doubles or even triples your risk of developing the disease. Why? Certain inherited genetic mutations, such as changes in the BRCA1, BRCA1, and BRCA2 gene, commonly linked to breast cancer, can increase prostate cancer risks. Additionally, hereditary prostate cancer accounts for about 5 to 10% of all cases. Men with a family history of prostate cancer should especially be vigilant, and genetic counseling might be recommended to assess their risks. Okay, number 3, risks of race and ethnicity. There is a higher risk in African American males. African American males have the highest risk of developing prostate cancer compared to men of other racial or ethnic backgrounds. Why? The exact reason is really unclear. Research suggests that a combination of genetic factors, socioeconomic variables, and health care access may contribute to this risk. It is also noted that African American men are more likely to develop aggressive, advanced forms of the disease and may have a higher death rate from prostate cancer. By contrast, men of Asia or Hispanic descent tend to have a lower risk. The awareness campaign in healthcare is essential to ensure timely screenings for all groups, especially in African American. Number 4, we're going to talk about diet and lifestyle, the role of food and physical activity. So the key fact, a diet high in certain foods may increase the risk of prostate cancer. Lifestyle habits can influence overall cancer susceptibility. So contributing dietary factors, red meat and dairy products. Diets high in saturated fats from red meat and full-fat dairy products may contribute to elevated risk of developing prostate cancer. Low intake of fruits and vegetables, poor consumption of antioxidants, foods, leafy greens, tomatoes, and berries may reduce the body's ability to manage oxidative stress and inflammation. Other lifestyle factors, lack of exercise, Sedentary lifestyles associated with obesity, inflammation, higher your risk of developing cancer. Obesity, while the direct link between obesity and prostate cancer is unclear, obese men may be at risk for more aggressive forms of the disease. So the key fact is adopting a healthy diet, Mediterranean type diet, and regular physical activity may help mitigate the risk. Number 5, hormone levels and the role of testosterone. Testosterone, the primary male hormone, plays an essential role in prostate health and cell growth. However, changes in hormone levels can influence prostate cancer risk. Testosterone can stimulate the growth of both normal and cancerous cells in the prostate. Prostate cancer is considered a hormone-sensitive cancer, meaning that its progression is often tied to androgen, male hormones, activity in the body. Treatments for advanced prostate cancer often focus on lowering your testosterone level, basically androgen deprivation therapy to slow the disease down. Number 6 is unexplained cases, no clear risk factors. Many cases of prostate cancer arise without any identifying risk factors. Even men with healthy lifestyles and no family history can develop this disease, likely due to random genetic mutations. Environmental factors often play a role too. Exposure to certain chemicals, pesticides, have been suggested as a contributing factor. Though research is ongoing, additional information on chronic conditions in the prostate may create an environment conducive to cancer development. Again, regular screenings are essential. Okay, number 6, section 6, we're going to talk about diagnosing. How do you diagnose and detect prostate cancer? So screening, testing, early detection is the key to success. Common screenings such as the PSA, prostate-specific antigen, blood test measures the level of PSA in your body. Elevated levels can indicate cancer or other conditions. So it is imperative you get your yearly PSA test. Also imperative is your digital rectal exam. Over 50, you need to have it. You need to buck up and just go get the test. It may save your life. So diagnosing it. If screening results are abnormal, further testing is typically required. Biopsy, a tissue sample is taken from the prostate to look and see if there's cancerous cells. You may also have an MRI or CT scan providing imaging of the prostate and surrounding tissues. And bone scans is also potentially on the table to see if your cancer has metastasized into your bones. Treatment options. How do you treat prostate cancer? Prostate cancer treatment depends on factors such as the type, stage of cancer, the patient's age, overall health, and personal preferences. Treatments generally fall into 2 categories: conservative for less aggressive cases and aggressive treatments for advanced or fast-growing cancers. Let's get into conservative treatment. These approaches are designed for slow-growing prostate cancers or cases where aggressive treatments isn't immediately necessary. They focus on monitoring the condition closely or slowing the cancer progression using medication. So active surveillance. This strategy is used when the cancer is not likely to cause immediate harm or affect the life expectancy. Instead of undergoing treatment right away, patients are closely monitored using the PSA blood test, biopsies, and imaging. The goal is to avoid unnecessary treatments while catching signs of the progression in its earliest stages. Medications, hormone treatment. Testosterone can promote the growth of prostate cancer cells. Hormone therapy, also called androgen deprivation therapy, works by reducing the levels of the testosterone in the body, basically blocking its effects on the prostate. This therapy may slow cancer's growth. It can be also used in aggressive treatments as well as part of that therapy. Hormone therapy can involve medication or surgical options, such as removal of the testes as well. Aggressive treatments. For fast-growing or advanced prostate cancer, aggressive interventions aims to eliminate cancer cells or stop their spread. So obviously the first choice is going to be surgery. Radical prostatectomy involves removing of the entire prostate gland along with nearby tissue and sometimes some of the lymph nodes that are surrounding the area. This is typically used in cases where cancer is localized in the prostate and hasn't spread anywhere. Radiation therapy is another therapy that you can use. Under high energy rays, the beam tends to aim to destroy cancer cells. Radiation may be delivered externally via beam of radiation targeting into the prostate, or internally via branch therapy or implanting a small radioactive seed into the prostate. So if you ever heard of somebody put a seed in the prostate, that's what this is. It's radiation therapy. It's a very, very small seed, and it goes into the prostate, and it is meant to have this type of treatment. Radiation therapy is commonly used for both localized and advanced prostate cancer. Chemotherapy. Purpose is a systematic treatment used when prostate cancer is spreading. It's metastasizing to other organs, and it's resistant to hormone therapy. Typically administering cancer-killing drugs via injections or oral pills that target fast-dividing cells throughout the body. Immunotherapy. This is an innovative treatment, activates and strengthens the body's immune system to recognize and attack cancer cells. Immunotherapy may be effective in specific advanced prostate cancers, such as those resistant to standard treatments. Let's talk about Section 8, lifestyle and prevention. Can you prevent prostate cancer? Well, no. There is no guaranteed way to prevent prostate cancer. Certain lifestyle choices and healthy habits can significantly lower the risk and support overall prostate health. So first, we'll talk about diet and nutrition, right? That's always the biggest one. Healthy eating, a balanced diet can reduce inflammation, regulate hormone levels, and support cellular health. Suggested fruits to eat. Fruits and vegetables rich in vitamins and antioxidants and fiber to reduce cancer risks. Whole grains provide complex carbohydrates for long-standing energy and digestive health. Lycopene-rich foods. Lycopene is a powerful antioxidant found in tomatoes, watermelon, and guava, particularly associated with reducing the risk of prostate. Well, that is really good for me because I eat watermelon like it's candy. It's one of my favorite foods, actually. It's my secret to trying to keep my weight maintained because watermelon is, hence in the title, water, and it is a melon, but it does fill you up, and it is good for your prostate. Okay. Lastly on the list is you're going to limit your red meat and high-fat dairy. Excessive consumption of animal fats can increase oxidative stress and inflammation, both linked to cancer development. Exercise. You got to exercise. Regular physical activity helps reduce inflammation and improves immune function and maintains hormonal balance, all of which are key into preventing cancer. Exercise can also help with weight management, as obesity is a known risk factor for prostate cancer. Routine screening, early detection through the screening process allows doctors to catch prostate cancers before it grows or spreads. So again, your PSA, your digital rectal exam are essential, especially for those over 50. Smoking. You want to quit smoking. It's no good for you. Don't do it. Smoking worsens outcomes for prostate cancer patients by increasing the chances of aggressive cancer and reducing the body's ability to respond to treatments like radiation. Quitting smoking improves both general health and prognosis for prostate-related conditions. By maintaining a proactive approach to health through diet, exercise, and screening, men can minimize risks and improve long-term prostate health, even if they aren't able to completely prevent prostate cancer. Okay, section 9, research. What's the future? Is there anything out there that is in the works that's potential? So if you're watching this, then you know I'm kind of a functional medicine type guy, and I'm all about regeneration and PRP and stem cell type therapy. So one of the cool things that I found is stem cell therapy, the future treatment for prostate. One of the most exciting advancements in prostate cancer research is the role of stem cells. In treating the stem cells and treating the disease, stem cells, which often are undefined cells capable of transforming into various specialized cells through cell transformation, might revolutionize how we treat prostate cancer. Here are a few ways that stem cell research is making waves. Regeneration of damaged tissue. Certain treatments for prostate cancer, such as surgery or radiation, can damage healthy tissue. Stem cells are being explored to repair and regenerate these tissue cells, potentially improving the quality of life post-treatment. Targeting cancer cells. Recent research indicates that some prostate cancers may have stem cell-like properties that drive tumor growth and resistant to the therapies. Scientists are exploring ways to target and eliminate these cancer stem cells. Immunotherapy enhancement. Stem cells can be engineered to deliver cancer-fighting drugs directly to the prostate tumors, improving the efficiency and specificity of the treatments. While these therapies are not yet widely available, clinical trials are emerging globally, and the future holds promise for more personalized treatment options. Other advancements that are out there are in immunotherapy by boosting the immune system to fight cancer more effectively, and more precision tailored medication. But the stem cell therapy, it's an interesting idea. And again, not a lot of information on that, but there is research. There's a lot of research on regeneration for not just the prostate, for many different conditions and treatments. And only time will tell if some of these conditions can be treated with this type of therapies and treatments. Part B to that is, if you do find cures for this, will big pharma, this is going to be controversial. You could throw the controversial tag on this. This will be controversial. Will big pharma ever allow that to happen? Right? Because big pharma is always all about medications for patients. Yes, they're trying to help patients, but as certain articles have come out, right? If you cure patients, then they don't need the medications anymore. So there is something to think about. Big pharma does play a role. There are things out there that can be treated that I don't think they put out there personally. But that is obviously for another day, for another time. So it is interesting, and it is something to watch. And I would say within the next 10 to 15 years, yes, it's going to be probably 10 to 15 years before research keeps coming up and keeps doing enough analysis before maybe something else like this is available. But it is interesting to think about. My final thoughts. Prostate gland is small but mighty, essential for reproductive health, but vulnerable to life-altering conditions like cancer. Understanding your risks, symptoms, and treatment options empower men to gain control of their health. If you or someone you know is experiencing symptoms or belong to a high-risk group, speak with your healthcare professional today. Remember, discussing prostate health with the loved ones and breaking the stigma around men's health issues can save lives. Again, as I say always, What you heard here is my opinion alone. It is not medical advice. It is not medical treatment. It is not medical therapy. If you have a problem or a condition, please see your physician to be fully analyzed for your own proper health. If you know anybody who has any of these conditions or needs more information or wants to understand this condition a little bit more, please pass this podcast along to them. The information you give them here might just save their life. It is critical to take life into your own hands because the information that we don't know or don't understand is what prevents people from doing what they need, right? People are scared. People don't know. They don't know where to go, where to turn, what to do. Some of the information I provided here hopefully helps you or helps a loved one you know and have a little bit of a better understanding of the prostate cancer, and some of the treatment options. But it is essential. Get screened if you're over 50. Make sure you're getting your yearly PSAs. Make sure you're getting your digital rectal exams. Yes, it's not fun, but yes, it is essential. Yes, it could save your life. So you please see your primary care physician for that. As I always say, this life that we have is important. Your health is important. Your health matters. I'm Dr. Chillemi. Till next time, be healthy, be safe.